There's no cream, there's nothing that will get rid of lines as much as Botox will. So if you've got frown lines, forehead lines, and lines around the eyes, when you're not moving, no expression, that is the time to start. There's 3 ingredients that everyone should be putting on their skin. Just don't believe anything you see on social media. Just because your favorite influencer's gone and had that treatment doesn't mean it's good. The most underrated treatment is actually, honestly, simple facial microneedling.
Today in the makeup chair and closing out this series is Dr Motox, one of the UK's most in-demand aesthetics and skin doctors. He's built a reputation for natural looking treatments with injectables and cosmetic procedures. So whether you follow him for his transformations or his Botox tips, Dr Motox has become a trusted voice in this space. So in this episode, we're going to get into how he's built that trust, what he wishes every patient knew before booking in, any red flags to watch out for, and we will myth bust some things in the aesthetics world. So for our final episode of season 1, please welcome Dr Motox to the makeup chair. Thank you so much for joining me today.
Thank you so much for having me.
It's a pleasure to have you. I want to jump straight into aesthetics because we've got a lot to get through, I feel like, and we need to cram it all in.
Let's do it.
How did you start getting into aesthetics?
I kind of fell into it about 10 years ago. So I used to work in a hospital where we would treat people who had like head and neck cancers or trauma or come in with palsy, and we would treat those kind of things. Plus, we would then use things like Botox and filler to actually help change muscle. So someone who'd come in with like, who've had a stroke or has had Bell palsy, where part of the face drops down, we'd use Botox to try and even things out to make things look more symmetrical. Or people who've had head and neck cancers where they have part of their jaws or their face removed, we could then use fillers to actually replace some of the volume alongside surgery. And I did that for a little while, and then one thing led to another. I started a little thing on the side, and then it just kind of blew up, and now we're here.
I think like people don't realise that it's actually medically used as well.
But that's how it started. So the way, for example, Botox started was it was this, there was this couple in America. One of them was a eye surgeon, one of them was a plastic surgeon. And the eye surgeon would use Botox for people who had like double vision, where their eyes would go to one side. And she'd use Botox to relax the muscles to move it back, or to reduce spasms around the eye. And this one lady came in and said to her, "Oh, this time you didn't inject my frown line." She was like, "Well, there's no spasm there." She was like, "No, I want you to inject it because every time you do, I look really young." And she was like, "What is going on?" And then figured out then actually, because you're relaxing the muscle, everything looks a lot smoother. And then one thing led to another, and then Botox just went absolutely wild. And now we just use it everywhere for cosmetic as well as medical. But yeah, it was used medical. And it was also used, it is still used for people with incontinence. So you use it around the muscles in the bladder to relax the muscle, because some people are incontinent because that muscle is relaxed. So you can change it so it contracts it, and then therefore you're not incontinent anymore. Right. So that's how it actually started. It was medical. It wasn't just cosmetic. But now obviously,
I feel like now it's so widely used, isn't
Everyone's
it?
having it done.
No one even knows that the background is actually more medical than aesthetics.
Absolutely. But you haven't had some yet, have you?
I had my first
Did you?
Botox this year.
Congrats.
First ever. I'm 27.
Fine.
So I just thought it was about time. Fine. And I don't know why, because I didn't actually have lines. I had it in June maybe, and I'm actually okay with it now.
Yeah,
I think when I first got it, I had a bit of a shock because I was going away 2 weeks later, and the sun was hitting me and I couldn't move my face. So I think sometimes it can look a bit harsh.
Absolutely.
Maybe it was the initial, but now it's kind of
now
settled.
It looks fab. But
Did you think I didn't have Botox?
Yeah.
Really? Yeah. Okay. Can you tell when people have had it?
No, not always. And that's the good thing about it. So Botox, we do it on a strength ladder, right? Let's call it like 0 to 10. 0 being super baby Botox, where you look no different, it looks the same. Number 10 being completely frozen, bit Donatella Versace, everything's like super lifted, right? So that one you can tell. And you can be anywhere you want on that scale. So if someone's...
is it dependent on what you want?
Exactly.
Preference?
So I can put you anywhere from 0 to 10. When someone comes and sees me for the first time, they're absolutely petrified because they think they're going to leave looking like Donatella. As much as I love Donatella, her face is
icon.
Not where we want to be. So I normally start everyone on this side of a scale, say like a 2 or a 3, where everything is still really moving. You still got lines, but things just look a little bit softer. As time goes on, people do like to go higher. And the reason people end up on the other side is, one, it just lasts longer, but two, it looks that little bit smoother.
Yeah.
But initially, I'd never start you there. I always start you super, super low. And that's
Yeah.
when you can't tell. Even I wouldn't be able to tell sometimes.
And speaking of baby Botox, like some people don't say that's a thing. Like, is baby Botox a thing?
It is and it isn't. So it's more of like a marketing thing. It's just easy to explain to people like, oh, baby Botox. It's not really a thing, no.
Yeah.
It's more about the scale. So the scale makes more sense, but from a marketing aspect, yes. And someone who's scared will always come in and be like, I want baby Botox. I'm like, what does that actually
Is
mean?
it the quantity that you're putting in?
Yeah.
Right, okay.
So it's like how much you're putting in. The more you put in, the more frozen it is. The less you put in, the less frozen it is. So yeah, so you can be anywhere on that scale.
I think I like a bit of movement.
Yeah, so do I.
I
like
didn't have a
mine.
top up.
And generally, I'm actually kind of against top ups.
Okay.
Kind of.
Why?
Because so sometimes some people need a top up. Like sometimes things go a little bit wonky, things are a bit higher, lower, whatever. That happens.
Is
very
that dependent on the person?
It does, and it also depends on your muscles because you have no idea how it's going to settle. So sometimes people just need to come back and you just need to even things out. Super easy. But if some people have top ups all the time because they think they're going to get better results or it's going to look better, but what will happen is you will become immune to Botox if you keep having top ups, because what happens is every time your body is given Botox, eventually it can see it as an enemy. It will fight it, which means anytime you inject it again, it will not work. And if it doesn't work,
Really?
honestly, later on, I know you're 27, you're absolutely fine, you probably didn't even need it, but later down the line, you will want it. And if it doesn't work, it's hell.
But I've never actually seen some, because if people like Botox, like people that love Botox, you can tell they love Botox.
Yes.
They have the Botox.
Yes.
But I've never seen it kind of not work for someone. Is it rare?
It doesn't happen very often.
Okay.
I've seen it, I say about 5 times in my
Right.
clinic where I would put Botox in. They come back that it hasn't worked. I'm like, no, surely not. I'll put a ton more in. Doesn't
Yeah.
work. Come back, put a ton more, and just nothing's happening. And I'm like, well, you've become immune. And usually when you sit down and chat to them and find out their history, it's usually, not always, but it's usually because they're having it too close together. So you really
Right.
need to space it out. Ideally, no more than 3, maximum 4 times a year. Ideally, 3
okay.
times a year is kind of the going
Every
rate,
quarter.
with as many little top ups as possible.
Right.
Because when it's immune, honestly, those people there's nothing else you can do because there's no cream, there's nothing that will get rid of lines as much as Botox will.
Is there any sort of cream that's anything close to it?
Nothing. And all these companies will tell you they're just
Any
not.
treatments that are close to it?
Nothing.
Nothing can smooth you
beats
out.
Botox. Nothing smoothens lines. Nothing does what Botox can do. It's impossible. Anyone who tells you it does is lying to you.
And the age that people are getting Botox
Yes.
is getting younger. Like,
It is.
It seems it anyway.
Absolutely. But that's because it's just more rife on social media. There isn't as much of a stigma. People are happy to talk about it. And be like, oh my God, it's kind of like a bit of a... I get people all the time who come in who are just like my normal paying clients and they're filming themselves having Botox. It's kind of a flex, right?
Yeah.
And because you're seeing a lot of that on social media, people think, oh my God, I should be having it done. So it is getting younger,
And
which
what
is scary.
the good age to start?
Fantastic question.
Preventative as well is a word I hear a lot when it comes to
Mm.
Botox. Like, I'm having it because it's preventative Botox. Is that a thing?
No.
And what age? No, it's not.
No. Well, yes and no. So there is not an age where you need to start Botox, right? Some people, it's when they're 27, when they're 30. Some people, they don't need to start it until they're 40. It depends on your skin and what is showing. So the time it's really important to start, if you want to not have lines later on, is when you have lines when you're not moving. So if you've got frown lines, forehead lines, and lines around the eyes, when you're not moving, no expression, that is the time to start. Because if that carries on for a lot longer, it gets to a stage where you can't turn it back. If you have Botox before that, yes, it will prevent it, but also it's not going to achieve anything more than when you start having lines. So as soon as you start having lines that are staying in the skin, that's the time you want to start it. The trouble with the other reason much younger girls are having it done is because your makeup, you probably found, sits very, very differently once you've had Botox, right?
Where does that glow come from?
It's like
Where does that, like, what is that glow?
there is the Botox glow, which is why young girls come and see me. They're like, my makeup just sits nice. I'm like, yes, I know, because everything just sits flawlessly. That glow is because the skin's not doing this all the time. It's not crunching all the time. So your makeup is not being moved all day long. So it just sits flawlessly on the skin. And again, because the skin's skin's not being creased all the time. The way the light hits the skin, it just bounces off. When it bounces off, it's a bit like how a mirror works. A mirror is so smooth, that's why you see a reflection. Everything's really, really smooth. It's a similar sort of thing with when you have Botox. Everything's so smooth. When the light hits it, everything just looks shiny and glowy. You also probably find, this is not the reason we do Botox, but you probably find you have less breakouts in areas where you have Botox.
Really?
Yes, and that's because you're producing less oil in areas where you have Botox, because as well as paralyzing muscles, it paralyzes the oil gland, so it reduces how much oil you produce, so you're going to get less breakouts. So you find anyone with lots of acne in their forehead and around the eyes, when they do have Botox, generally that will reduce.
Really?
But it's not a treatment I would do to get rid of
I was going to say, if
no.
someone came to you like, I've got acne.
No, that's a completely different thing. We'd try and find the cause of their acne and then treat the acne that way. And that might be lasers, it might be usually home skincare, retinol, salicylic acids, all that kind of stuff can normally deal with it.
I was going to say, for people that do have acne and stuff like that, what's a regular treatment that you would offer?
So the most important thing for acne is salicylic acid.
Right, okay.
And I'll tell you what that means in English.
Yeah, for those who don't know.
For those who don't know. So the reason most people have acne and breakouts is because you're just producing too much oil for whatever reason. That oil gets clogged up in your pores, you get bacteria around there, and everything just goes crazy. You get loads of inflammation. So what you want to do is wash out all the oils from the pores. And the way you wash out oils is using salicylic acid. Salicylic acid basically melts oils from the pores. It washes it out. So when you have less oil there, your pores shrink, was one thing that you find.
So that means your pores will look even better as well.
Your pores look better. So your pores shrink, you have less oil, and normally in most people, that reduces. So normally I would put people on a system, which is called the Cleansiderm system, is the one I use. For example, it has a salicylic acid face wash and it's got a salicylic acid toner. And those two things together do magic. I'd say about 80% of my clients will respond to that beautifully. There's some people who need a little bit more. Sometimes we might have to do lasers, peels, all that kind of stuff to try and control it even more, because there's a bit more going on. But that is the key ingredient.
Do you recommend sticking to like 2 base things that you have and then just keep into that? Don't be trying loads of different stuff.
And I get it with acne patients. It's so difficult because you just want to try everything, right? And you've got no time for it. But these things take a couple of weeks to get to where you want to be. Usually I tell people, give me at least 8 to 12 weeks to really calm things down and just stick with the same thing. Because if you try loads of different things, you're actually going to make things worse, because you're feeding bacteria, then you're reducing, then you're producing more oils, and you will find things become worse. So use something and stick to it. And usually it's a salicylic acid. And my favorite ones are those 2 I like. There's one by Obagi, do a fantastic salicylic acid.
Obagi's amazing,
Stunning,
though, isn't it?
incredible. They do something called pore therapy, which is one of my favorite salicylic acids. Or number 2, Medicate, do something called Press and Clear, and it is, again, beautiful. It's a salicylic acid. You can use it twice a day, and most people, about 3 weeks later, I always tell people you will see a huge difference.
Really?
Yeah.
Top tips.
There you go.
Question, and this is a personal question because I'm suffering right now.
Tell me.
Perioral dermatitis. Do you do anything for that?
Do you find that comes and goes at certain times?
I had it about a year ago. Got rid of it with my toothpaste because it was fluoride.
Good Lord. Right.
As in, like, no,
As in,
I
like,
swapped out my toothpaste. I didn't put the toothpaste.
I was like, you like sitting at home rubbing toothpaste on your face. I was like, good Lord, let's not put that out there. So it probably wasn't the fluoride. It's probably the other ingredients in it. Probably the SLS in there, like the foaming ingredient. Oh, really? In there, usually,
well, I swapped it out.
Yeah.
And then it went away, and like the last month it's came back. So perioral
dermatitis is a nightmare to treat, but there are a few things. So first thing is you need to be using that salicylic acid.
Really?
Right?
Okay.
And salicylic, you don't have to use it everywhere. You can just use it in breakout areas. So use it on a little cotton bud, go all the way around. I would start by using it once a day in the morning. If your skin can take it, then twice a day. When I say your skin can take it, sometimes salicylic acid can dry your skin out because you're getting rid of all the oils. But if you can take it twice a day, even better. That's number 1. Number 2 are chemical peels. Mainly salicylic acid chemical peels, just to remove that top surface layer of the skin. And sometimes you might just need a course of antibiotics, and that usually deals with it.
I get a bit scared about going to the doctors with stuff like that and getting antibiotics, and I'm a bit nervous about steroids.
Yeah,
the steroid creams.
Yeah, avoid putting steroid cream if you do not need it.
Yeah.
Steroid cream is hell for thinning your skin, aging your skin, and causing long-term damage.
Yeah, my friend James, who does skin and all stuff like that, he had a reaction to the steroid cream.
Yeah.
And it's steroid withdrawal.
Yeah.
Have you heard of that?
Awful.
Yeah.
Horrendous.
Obviously you've heard of it.
Yeah.
But that really scared me, and I'm like, I never want to touch that.
If you can avoid it, then great. Listen, some people have some conditions where you just need steroids. Steroids like calm inflammation and reduce how your body reacts to things. And sometimes you just need it for certain conditions. Ideally, I wouldn't use it long term at all, because the damage it does to your skin long term is awful. So if we can use other things to deal with it, then absolutely. But for you, salicylic acid.
Okay. I'm noting
And
this
potentially antibiotics. Do you find like it gets better or worse around like your menstrual cycle?
I've not had it yet.
Oh, fine. Well,
So
you'll find
we're
out.
waiting.
Normally what happens...
It's due.
Normally what happens as soon as you start, it will get a lot worse.
Right, okay.
Because your hormone levels will change how much oil you produce.
Right.
So acne patients in particular need to be using their... As soon as they know menstrual cycle's around the corner, you start using salicylic acid as a preventative treatment, and that will really calm things down.
Okay.
And some people are just prone to acne, right? You're going to suffer with it for the rest of your life. In fact, you normally start with it gets better, and then you get later on in life, it actually gets worse again.
Things change.
Your hormones are changing. It's
Does
very
it depend
hormone based.
on pregnancies and stuff like that?
Pregnancy normally actually is usually a bit better around pregnancy.
Really?
Yeah, because your hormone levels are a lot higher. Usually around menopause and perimenopause later on, your hormone levels drop, which means your oil production increases, and then you'll get acne. But there's things you can do to reduce it. One is dealing with your hormone levels. You need to see someone about that. But two, you need to be doing your home skincare routines and all that kind of stuff to really calm things.
And what kind of routines, like what devices, what things do you use that you actually swear by?
In terms of skincare routine, everyone's skin is so different. So what you put on your skin might be completely different to what I put on my skin. So ideally, you need to go see someone who tell you what to put on there. But generally, there's 3 ingredients that everyone should be putting on their skin, right? So number 1 is vitamin C in the morning. It's an anti-inflammatory and it's an antioxidant. It really helps calm everything down and gets you ready for the day, makes you produce loads of collagen, loads of elastin, which just helps to reduce aging, all that kind of stuff. So pretty much everyone needs to be on that on a daily basis in the morning. At night, it's a retinol or a retinol, so vitamin A. It's the most anti-aging ingredient you can put on your face. There's nothing more important than retinol. It will reduce your pigmentation. It will reduce your acne. It will reduce your rosacea. It really calms things down massively. That's number 2. And then number 3 is SPF. Without any of these things, sun damage to your skin is going to flare everything up. It's going to make everything worse.
daily?
Every single day. Even if it's thunder, lightning outside, that kind of light will cause damage to your skin.
Right, okay.
And SPF is a bit difficult because everyone has preferences, which is understandable. Some people don't like one company compared to others. So normally I don't actually endorse any specific SPF. I'm like, whatever works for you, I don't care, just put it on.
Yeah.
Other things like vitamin C and retinols, there are some companies I wouldn't, and some companies I definitely would.
Give us a retinol that you like.
There is my favorite retinol on the market. There is nothing better, and I'm not even paid by them, unfortunately. I will take payment if you want to give it. Is by Medicate.
Oh, okay.
Medicate make the best retinols on the market. There is nothing better over-the-counter retinols.
Because there's some that are quite harsh.
Correct.
I know people that have used a retinol that has like burnt their skin.
Yeah, absolutely, and I get that. Every single day someone says that to me in clinic, like, no, I'm allergic to retinol. I'm like, you're not allergic to retinol. What happens is lots of companies make retinols at different strengths. And the retinol you can also get at a prescription level, which is incredible. It's the most beautiful thing you can put on your face. But if you start at the higher end of the ladder of strength, what will happen is your skin will go flaky, you go dry, you'll get breakouts, you go through a purge, you'll hate it. And a couple of weeks on it, eventually your body's like, okay, yeah, no, this is fine, and it deals with it. But generally, I personally wouldn't want to go through that, right? So what I always tell everyone is start with a company that has a big range, from very weak to very strong. So that's why I love the Medicate one, is they've
got a range.
They've got a range. I think there's like 5 or 6 different strengths.
Oh, okay.
So you start really, really low, use it like twice a week, if that, at night. And then every week you might increase by a day, and you keep increasing, and just listen to your body. If you get a bit dry, a bit flaky, then just stay on like 2 days.
Yeah.
And then go up until you're using it every night, ideally. And then once you get through a tube and your skin's okay with it, then you go higher and higher and higher. The higher you go, your skin will shine, you have less breakouts. Honestly, you'll see a massive, massive difference.
Just don't jump in the deep end.
Just don't. It's like low and slow.
Really,
really low, really slow. But that's why I just love it's just formulated beautifully. Like it's made by a chemical scientist who's absolutely incredible and really knows what he's doing. The ingredients in there are incredible.
Yeah.
Again, but even with them, I would start low and slowly work your way
Mhm.
up, and you will see results. It's fantastic stuff.
Okay, noted.
There you go. That's your retinol.
I love it. Let's get on to a little bit about filler. Because
Yes.
have you seen like a rise in filler, or are we staying the same? Because I feel like there's a bit of a trend now to be in your natural glow era.
Yeah, it's very much a thing. Agreed.
Do you think
That is
that?
absolutely, yeah. So when I first started about 10 years ago, everyone wanted to be plump, full. Everyone wanted to look like they had filler because it kind of came with a status of like, I can afford filler and I can have filler, and I'm looking like these celebrities who looked awful at that time as well because everyone was so puffy. And then luckily in the last couple of years, that's completely changed. I am doing more dissolving than I've ever done before.
Really?
I'm dissolving people all the time where we're taking all the filler out and normally starting again. So our attitude has changed towards filler, but everyone is still having filler. But
It's a
people are just not
natural
talking about it anymore,
Getting it
unfortunately for
dissolved
me.
and not saying that they're plumping back up.
Everyone, including people like Molly May, are saying they're having all their filler dissolved,
Yeah.
but they are having it put back in, 100%.
Right, okay. So they're going to more natural, but it's still...
It's just done a lot better. So
Yeah.
everyone's having treatments done that are not noticeable. So you have it all dissolved. When you have it all dissolved, you have a panic attack because you see what looks like underneath there. So
Yeah.
people are having it done tiny amounts over a long period of time. That way you will never ever look like you've had filler. I always say when someone comes to see me for the first time, the first thing I say to them, I can guarantee I can make you look like you don't have filler. That's easy. No one will ever know. Your partner will have no idea. That's the easy part.
Yeah.
The trouble is it's a slow process. So my way to it is you put a tiny bit in, you let it settle. 2 weeks later, everyone's always disappointed. Everyone always wants a bit more. You're not allowed.
Yeah.
I like to wait a few months and you put a tiny bit more. If you do it that way, I can guarantee no one will ever know you've had it done.
What do you think about my lips?
Stunning.
I've had 0.5 once a year. So twice.
That's all you need. That's all you
And
need.
I think they're okay.
And that will stay like this
Yeah.
for a very long time.
Yeah.
Everyone always thinks filler dissolves.
I was going to ask you about the myth of does filler dissolve?
No.
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 So where does it go?
It doesn't. So what happens is you put filler in,
Yeah.
it swells up slightly, then the swelling starts to go down over 2 weeks, and then your body does get rid of a lot of it, right? It digests it, so it turns it like into water, and then when you go to the toilet, it comes out the other side.
Yeah.
But there's a little layer that your body just cannot get rid of. So every time you have filler put in the same place, you build up a tiny bit of that really stubborn layer. So as you build it up, you need it less and less and less and less. So for example, I do a lot of people's noses. So I do lots of like straightening noses, lifting tip, like reducing humps and bumps. After I've done people a good number of times, it gets to a stage where they come back like, oh, I think I need it again. I'm like, where?
Yeah.
Everything looks completely straight. And they will normally be like that for a couple of years before then potentially I might see it again.
Is that like filler blindness?
That is filler blindness.
Yeah.
And that's what happened with everyone's lips. For example, not to bash Love Island, we love Love Island, obviously. But all the girls that were going on Love Island, for example, were having like big juicy lips way back in the day. Whereas now, when people are going back on All Stars,
Yeah.
everyone's lip is so lovely because they've had it dissolved and done naturally.
My mate Olivia has just had hers dissolved and
Yes.
she looks amazing.
It just looks better.
I feel she looked beautiful before,
Yeah.
but she looks
Stunning.
amazing now. And she loves her lips a little bit smaller, and I just think it's the natural glow
It's
era.
very much in. That's it. That's the natural girl era is in, and I'm so into it. I'm very much for it.
Was there a point where the trend was big and you were a bit like,
Yeah, when it
not
was
into
happening,
this?
I was like, what on earth is going on, girls? Why are we doing this?
is there a point where you would turn people down?
All the time. I do that on a
Really?
daily basis, every single day.
And is it mostly fillers?
Mostly filler.
Yeah.
Botox generally makes everyone look a little bit better, but fillers 100% all the time. I'm like, you just don't need it, because what will happen is I could do it, you will end up looking worse rather than better, and I'm not willing
And you
to put
don't
my
want to
name
put
to
your
that.
name to it. Yeah,
That's
of course.
that's not my aesthetic.
Yeah.
So that's why a lot of the work I do that you'll see that I'm known for is a lot of dissolving and refilling and make things look
And
natural.
does dissolving damage your lips at all? I heard that recently, and I was like,
that is kind of a myth. So what happens is when we inject dissolver, it breaks down hyaluronic acid. Filler is made up of hyaluronic acid, and our body naturally has lots of hyaluronic acid. All the creams and everything you use will have loads of hyaluronic acid to hydrate the skin. So when you put dissolver in, dissolver breaks down and gets rid of all hyaluronic acid that it touches in that area, including your own natural hyaluronic acid. So you find when people have their lips dissolved, when it dissolves, it goes really crinkly. You look like a prune. And that's because it's removed the filler plus your own natural hyaluronic acid, and your lips have been stretched and everything's been lost and everything. It's like a balloon. It just shrinks. But what does happen over the next couple of weeks, your body brings its own natural hyaluronic acid completely back. So it doesn't cause any long-term damage.
Hyaluronic acid injected apart from without the filler?
Yes.
Okay.
So filler is lots of little hyaluronic acid beads all stuck together, so that they hold their shape, and it's made in different thicknesses, like a really thin one to a super, super thick one. But you can get ones that are not bound together at all. So that comes things like Profilo and 70 High Al. Do you remember 70 High Al?
I remember 70 High Al, yeah.
So those kind of things, they are hyaluronic acid that don't add volume, don't add shape, nothing's bigger. It's like an injectable moisturizer. It does a lot more than that. That's the way I explain it to people. It's like an injectable moisturizer. So you inject it, it spreads under the skin, it absorbs water, and it feeds it to the skin. So Profilo is probably the most famous one. And that's what all the celebrities will now talk about when they come and see me. They'll be like, I've just had some Profilo. I'm like, well, no, we've done everything else, but you've also had a bit of Profilo, yes. And that just hydrates and improves the quality of the skin. So we can inject that stuff back into your skin, and we do that quite a lot, especially for slightly older patients who naturally lose a lot of the hyaluronic acid. We inject it back in the skin, and your skin just shines, it just glows.
Right. And what's your thoughts on Russian lips versus normal filler?
Russian lips are just not something I...
Do you not do that?
Absolutely not.
Okay.
Russian lips is trying to change your lip shape to something that is not yours. So it's a lot more obvious. It involves a lot more trauma. It's putting a really thin filler and really trying to lift, but actually you're going to make the lips puffy and you're changing someone's natural shape. So I don't mess around with that. It's not for me. So the way I do my lip filler, the way I say to all my clients is, all I'm going to do and all I'll ever do is enhance your own natural lip. If you've got a beautiful lips shape, I can enhance it and make it look a bit more hydrated, a bit better. I cannot give you someone else's lip shape. If you don't have a Cupid's bow, I cannot give it to you. It's impossible. All I do is enhance what you have.
Yeah.
So you just look the best version of yourself. Whereas the other kind of techniques that are a bit popular in the non-medical, usually, side of the industry, it's just not something I mess around with.
Yeah, I love that. You stick to your...
I've got my rules and I'll stick to it. I don't care who.
I love it. And what is your thoughts on body filler, like bum filler and all that?
That, again, it's not for me. Just for a few reasons. So some of the results that you see, for example, bum filler, incredible. You want that lifted.
Is it
juice.
safe though?
No, that's why I'm so against it. So for you to get those kind of results, for example, in a lip, we're using 0.5 ml to 1 ml of filler max. That's the max I do.
Hundreds?
That use 100 ml of filler, right?
That's crazy.
Filler so some of the things that can happen with filler is you can block blood vessels. So it can put pressure on a blood vessel, so it stops that area getting blood supply, which means the skin can die off. If the skin dies off, that's it. But you've disfigured for life. If you're putting 100 ml of filler into an area and the complication happens while you're doing it, how on earth are you going to dissolve that filler? In a lip, I've always got dissolver ready in my cupboard, ready to go in case something happens. I just inject it. You don't really have a choice in the matter. I sit you back and I inject that and get rid of it.
Yeah.
If you've got 100 ml of filler, there's not enough dissolver in the world to remove 100 ml of filler in one go. So that's number one. Number two, things, for example, like a lot of people are starting to do like breast filler. So instead of having
I've not even heard of that.
Oh, hell. Good. Please don't listen to it. So people are having filler put in their boobs to make them bigger and all that kind of stuff. So again, my gripe with that is, one, the safety of dissolving it. But two, for example, in women particularly, if you're going to put filler over that area, you're going to cover little lumps and bumps. How are you going to feel lumps and bumps? Because all you're going to feel is filler. You're going to think it's filler.
Oh my God, that's so true.
So let's not do it.
Yeah, that doesn't
Body
sound
filler,
good.
no. Face filler, yes. If it's done well, really slowly, over time, by someone who knows what they're doing, absolutely. The kind of results I get, stunning.
If you're sat on it, would that not spread
it can move
out?
it, yeah, of course.
Yeah.
And it'll break it down.
Yeah, it's a strange one. I've always been curious about it because it's popular, but
unfortunately,
I can't see it being like safe.
But the problem is sometimes some people are insecure about their body, right? And they really want to make change, and they'll do anything to make those changes. And I get it. I see it all day, every day in my work. But those people are just not educated by people who should be educating them. It's not their fault at all. It's the people who are doing the treatments. That's where the problem comes in. They're not educated enough by those kind of people.
And I know we've just touched on it a little bit, but is there any more treatments that you won't offer because you just don't agree with them?
A few. So thread lifts. Generally.
I was going to ask you, is that the fox eye lift?
Yes.
Yeah.
So back in the day, I did try it out a bit.
Okay.
It wasn't giving what I wanted to give.
On
So
yourself or on other?
on other people.
Okay.
I haven't had it done yet. I've had everything else. So thread lifts are like really big sutures that you put into the skin, and they've got like little barbs on them, and you lift the skin up on top of it, so everything looks
The
super
barbs
lifted.
scare me.
They are scary. It's a really painful treatment.
Really?
It's really, really uncomfortable.
Do you have to get put under?
No, and
Okay.
it's a traumatic treatment as well.
Right. Okay.
So yeah, you put these threads into the skin and you lift everything. So everything does look super lifted for about 2 weeks. 2 weeks later, you find most of that drops. So the results are very minimal for actually what you go through. That's number one. Number two, it's probably painful for about 2 months before it settles down. And three, you've got a huge suture now under your skin, which is going to heal by scar tissue, which means you're going to have a load of scarring underneath the skin, which means later on, if you ever decide to have a facelift, which a lot of people in this era probably are going to end up that way much later on down the line. If you are going to have facelifts and surgeries, it's going to be a lot more difficult to achieve that. So that's one treatment I don't really endorse.
And just touching on the facelifts with the fillers, because I had Ashley Stobart on and she was talking about her facelift.
Yeah.
And when
Which
they
looks incredible on her, by the way.
yeah, it does look
Stunning.
great. But in there, she said they had to basically scrape out all of her filler because it just wasn't dissolved.
And usually when I say, if people are going for like major facelifts and things like that, they need to go see someone to make sure all the filler is dissolved. Because to me, it makes no sense going to have treatments and facelifts if you've got a load of filler there, because you want the surgeon to lift it up to the maximum you can lift it. And don't get me wrong, you probably need, so once you have a facelift, that's not the end. That doesn't mean like all your problems are sorted. You will still need some injectables. You will still need your Botox. You will still need your skin booster. You probably need a little bit of filler here and there to even things out a little bit. But I would say get rid of everything before you have anything like that. And sometimes if you're not sure, you can have ultrasounds to check if there is some filler in there. So that's probably what I would have done for her.
Yeah. What are green flags when you are trying to find a aesthetician? Is that a word? Aesthetician?
Yeah. And the main thing is you want someone medically qualified there, because if something goes wrong, you need to know that someone can look after you and make sure that is reversed and all that kind of thing. So that's number one.
There's a lot in that.
There's a lot.
There's a lot of people doing treatments, isn't there?
Yeah.
And how qualified do they actually have to be?
So technically, I could spend a couple of hours with you later, and by the end of today, you could be qualified to do all the treatments that I do, which is wild.
That is wild.
Crazy. It's just not acceptable.
It makes me uncomfortable that I could be
You could be an injector.
People.
You could be an injector.
But I don't know the anatomy of the body or even
I will teach you that technically in my little 1-day course.
Right.
I will teach you the anatomy. I'll teach you what Botox does. I'll teach you exactly where to inject. I'll teach you how to use fillers the same day. I'll teach you how to do CPR all the same day.
Are you teaching me what I'm avoiding in the skin?
I'm teaching you all that, but I can teach you all of that in like an hour because I can just talk at you. You have never injected anyone. You've never ordered Botox. You've never done anything to do with it. And from that day or the day after, all you have to do is call an insurance company and say, I've got the certificate. They'll say, yeah, that's fine. You can start injecting people.
Does it have to be a certificate that, like...
No, that's the problem.
Right, okay.
That's
so it's not really...
It's just not regulated at all.
Okay.
The government have absolutely no control over it. There's talks about things coming and like you have to do a few things here now, but it's all a load of bullshit at the moment. So just because someone's wearing scrubs and has got like a nice clinic on Harley Street because they've hired a room in Harley Street does not mean that they are qualified. So you want to check they're actually medically qualified. Some people also, I've seen it on social media very recently, where they call themselves a doctor and they're not a doctor. And just because you use the word...
How can that be allowed?
Technically, it's not, but who's going to regulate that? No one. There's no one there chasing these people up.
Yeah.
So there's a few people I can think off the top of my head who call themselves a doctor. They are not a doctor. And if you approach them about it, they're like, oh no, I got my qualification in another country. That's not how it works. If you're gonna practice and call your doctor here, you need to be on the GDC register to call yourself a doctor. Or if you're a pharmacist injecting, that's fine. You need to be on the pharmacist register. So you could probably check people's names on registers.
Yeah.
That's number one. Number two, you want to see someone who'll say no. That's probably the most important thing about
I think that's
a red
really
flag.
important. Yeah.
If you go to a clinic and you're like, I want this done, and they're like, let's go, you'll be made a fool of. You want someone to say, no, this isn't the suitable treatment for you, or actually, this is what we should consider rather than this to achieve what you want. Or even to say, I can't achieve that. That's impossible. So the most common thing I get, two most common things are, one, people come in, loads of young girls come and ask me about nasolabial folds, which is the smile lines.
Yeah.
They're like, right, I want a load of filler to get rid of this. I'm like, well, no, because if I try to get rid of that, I've got to put so much filler in there, you're going to look puffy.
How
and two,
do
it's
you
impossible.
treat that? Because I don't like mine.
There's not a lot. So a tiny bit of filler will reduce it. It will not get rid of it. Okay. The kind of things you want to do is you want to get as much hyaluronic acid and as much collagen in there. Collagen acts like a scaffold. It holds things up.
Right, okay.
As time goes on, those drop down. So the more we have of that, things are more lifted and stay lifted and further back longer. So the kind of things you need to be doing is using vitamin C and retinols that we discussed. 2, microneedling treatments are stunning. Microneedling is a little pen with little needles. It just jabs the skin. As it jabs the skin, it makes you produce loads of collagen, so it smoothens everything out. That's number 2. It's not that painful.
Okay.
It's not that bad. I mean, nothing in my chair is pain-free. Everything involves needles. But no, it's not too bad. And then number 3 is Profilo, like we said. If we inject a load of hyaluronic acid back into the skin, it will hydrate it and improve the quality of it.
Yeah.
But sometimes some lines you just got to accept.
Yeah.
They're just the way they are. And if you start injecting them, you can actually look worse rather than better. Don't get me wrong, much later down the line, where people lose a lot of volume, you can use filler to reduce them quite a lot. But at your stage, absolutely not. You just need to be using your vitamin C's, your retinols, your microneedling, all your like home skincare stuff is going to do a lot more than what I can achieve for you.
Noted. And how do you feel about skin boosters?
Love them.
Love them.
Stunning.
Okay.
They work for everyone. For an older client or for someone with more dehydrated skin, you will see more results. For someone like you, where actually quite hydrated, your skin quite nice, it will hydrate you a little bit, but what it's doing more is making you produce collagen.
Okay.
And collagen, the more collagen you have over time, the slower things start to drop down. So it's that, I would say, is more of a preventative treatment over Botox.
Right, okay.
Are skin boosters. Most people should probably consider some sort of skin boosters to keep things hydrated. And those examples of that are Profilo and polynucleotides. So that's like the salmon sperm injections. So that normally we inject under the eyes.
Is that salmon sperm?
So salmon sperm injections are not actually salmon sperm. Someone hasn't gone there. And
Do you think that was like a bit of a marketing
Yeah,
thing?
absolutely, yeah. And I get it all the time. Like, I can have some of the salmon sperm injections, which blew my mind when it first came out. I was like, why are these people okay with me injecting salmon sperm into them?
Yeah, but if it works, it works.
It works, true. So it comes from salmon sperm DNA. So the DNA is extracted from the sperm, and the fragments are then used and then put with
There's a little
hyaluronic
bit
acid.
of truth in it.
There's a little bit of truth there. It's not completely wrong, but it's not actual sperm being injected into your skin, because that'd be wild. It's like sometimes, you know, when sometimes some men say to women, "Oh, if you have like a sperm facial, that make your skin better."
Yeah.
That's also a lie. Don't fall for that one, girls.
that one.
This is a load of rubbish.
So we spoke about the green flags when you're looking for a clinic. What are some red flags to avoid?
Red flags, people call themselves doctor and then hot doctor. People putting up, you'll see a lot of photos, before and after photos on social media, which are very different, right? And people come and show me all the time, like, oh my God, can you do this? I'm like, no, we're in the AI era, right? I can make anything look good by changing lighting and editing things. So edited photos, which I know is sometimes really, really hard to actually pick up. Take before and after photos of people in completely different positions. So I could take a before and after of you right now without doing any treatments, and I could make it look like I've done 1 million treatments on you. So it's trying to pick out those little things from these clinics are key. If something looks too good to be true, it is too good to be true. I'm seeing, like, for example, all over TikTok, there's someone who I will not mention, who's like doing like slimming your nose procedure, injecting like a product that they've combined and made. They won't tell you what it is.
What, like a concoction?
A concoction. It slims your nose.
Oh.
Load of rubbish.
Yeah.
It does not work.
Okay.
In fact, it can cause a lot of damage. No. We don't know what it is because they won't tell you.
Oh.
But it doesn't actually. It's impossible. How can you slim a nose by injecting it with a load of product to try and dissolve it? And even if that did work, how is it okay to try and dissolve part of your nose? It makes sense. There's no scientific backing behind it.
No.
So these kind of things and these kind of gimmicks and these kind of trends, just be a little bit more aware. Just don't believe anything you see on social media. Just because your favorite influencer's gone and had that treatment doesn't mean it's good. Just do a little bit more reading rather than just listening to these people.
And a treatment you think is underrated?
The most underrated treatment is actually, honestly, simple facial microneedling.
Oh, okay.
Most underrated treatment there is. So that's not even anything I actually do. And that you can see like a facialist esthetician, someone who is qualified in doing microneedling. And what they would do, they would cleanse your skin, they would do a little facial, they'll cleanse, move everything. And it's a little pen that just jabs and it makes you produce tons of collagen. It renews your skin. That is probably the most underrated and not enough talked about treatment.
And is there a downtime after that?
Yeah, so you leave the clinic looking quite red because we've just jabbed your skin head to chin. From the next day, it's normally actually okay, and you can start to put some makeup on from the next day. It should be absolutely fine.
And what's an overrated treatment?
Overrated treatment, I would say probably actually tear trough filler.
Oh, really?
Yeah, and that did do the rounds on social media, and then it did the rounds in a positive light for it. Then it did the rounds for it in a negative light for it. And the reason it's overrated is because most people are not suitable for tear trough filler.
Yeah. I have actually met a few people that it just won't sit right.
Yeah, because a few reasons. One, because they're not suitable.
And what makes you suitable?
So the under eyes look the way they do for three main reasons. Number one, the skin is really thin. Because the skin is thin, it's really see-through. Because it's see-through, you see all the blood vessels showing through. So everything looks dark, purple, and pigmented. Filler's going to do absolutely nothing for that. Filler does not thicken skin. It will still be see-through. Okay.
Yeah. Are you just kind of putting a little barrier in between it? What does the filler even do?
The filler, well, it depends how you inject it. If you inject it too superficially, so just underneath the skin, above the blood vessel, just underneath the skin, it will absorb water and it will look puffy, and you'll see it looks like a bit of a bruise. You've got like this blue color. It's called like the Tyndall effect. And a lot of people inject it like that because it's a lot easier to inject like that. If you inject any other filler in that layer, which is what most people do, it will look worse because you will look puffy because filler absorbs water. So bam, straight away it looks worse rather than better. The way you want to inject filler is really deep, which sounds horrible, but it's actually not too bad. You inject it right deep under the muscle, under the fat, where the bone is. So it lifts everything up so you can never ever actually see the filler.
Yeah.
But that only works for someone who has hollowness. So if you have a hollowness under your eye, you put filler underneath it. Game changing, stunning. It looks a little bit more lifted. Your photos look different, and that's what I say. Normally, photos look different, and concealer sits a bit nicer if you're suitable. If you're not suitable, and it's because you're having it because you have thin skin, or if you have puffiness, if you naturally have puffiness and you put filler underneath there, you're going to push that puffiness out more.
Yeah.
It's going to look worse, right?
Yeah.
So those are the three main things. It's like thin skin, it's the hollowness you can treat, or puffiness. Puffiness you cannot treat. Puffiness needs surgery, if I'm told. That's the only thing that will deal with puffiness.
Is there anything that we can do for under eye?
So one is polynucleotides. So polynucleotides just make you produce a load of collagen, loads of elastin, which just helps to slightly thicken up the skin. So the thicker the skin, the smoother things look.
Okay.
Or what I say to everyone I do polynucleotides on, it will not get rid of darkness, it doesn't get rid of dark circles, and it will not get rid of puffiness. TikTok will tell you it does. It does not. All it does, it reduces crepiness and fine lines and slightly thickens up the skin. Not a life-changing treatment, but it is quite nice.
Yeah.
Just do a little subtle change. That's number one for under eyes. Number two, microneedling. You probably gathered I love microneedling. You do, honestly, it's stunning. And like 2 weeks later after microneedling, your skin just glows.
Really?
You do go, there's a little bit of flakiness in between, but it does glow.
Dry?
Yeah, it goes a bit dry just because the top surface layer of the skin just falls off. But yeah, under eyes, polynucleotides and microneedling. Good quality skincare, vitamin C's and retinols. You have to be careful with retinols under your eyes. You want to use a specific under eye retinol. Most other creams that are made like for under eyes, you don't need to be using under eye one. You can just use a face one on your under eyes. It's a bit of a marketing ploy. The under eye retinol, you have to use an under eye retinol because it's made slightly weaker because the skin's a lot thinner.
Yeah.
So example, Medicate do a range again, under eye specific retinols on that ladder strength that we spoke
Get
about.
Medicate.
Honestly, Medicate's fantastic.
Right, question. What is the craziest request you've ever had?
I had one once. Someone came and asked me to make them look like Pete Burns. If you know who Pete Burns is, if you're a Big Brother fan, or
we'll insert a photo.
Insert a photo, yeah.
And icon, by the way. I love
absolute
Pete Burns.
icon on Big Brother. Pete Burns was
so iconic.
Chef's kiss when they had the do you remember when the gorilla
the coat
jacket confiscated. Iconic. Pete Burns was known for looking
the filler.
The lips were massive. There was, I'd say, at least 20 mil of filler in that.
How do you even achieve that? You can't do that in a short amount of time.
I couldn't achieve it. It's impossible.
Yeah.
I have no idea how you can even make it look like that.
And someone to say yes to it as well.
Wild.
Yeah.
But that was way, way back in the day as well, where filler was not really a thing. Like, only the really
Do you think
elite
you had a mate
it.
that was just filling?
Oh, it was only the elite that really had access to filler way, way back in the day. And obviously, he was part of those circles. So I did have someone came and said, I want you to make me look like Pete Burns.
And had they had filler already?
No, it was they literally had like skinny little lips. And I was like, what on earth is going on? So I had to kindly say, that's not the kind of treatments I do. But with those kind of things as well, you have to think, has this person got an issue that I need to see someone about? Well, sometimes they don't. And they're just like, actually, this is the aesthetic I want to go down. I treat a lot of drag queens. I treat most of those drag queens in London are my clients. And some of them want to look natural. They want to look like out of drag. They want to just look great, which is fine. But some of them want to look sculpted, lifted and pumped up. And that is actually fine because they know that that isn't your day-to-day natural normal look.
It's the aesthetic
It's the aesthetic they want for their work and their drag, because when things are plump, lifted, you've got super high cheekbones, juicy lips, putting makeup onto that and doing your contouring is easy. Everything looks lifted, snatched. So if you know that what you are achieving is not natural, it's not the norm, and you've made that decision by yourself and you're happy with the decision you made and you're giving full consent, I don't have as much of an issue with it, right? I'm not going to judge you. That's not my whole job is not to judge people. I genuinely will be like, well, we will have a conversation, like, just to make sure I don't want to put my name to it. Two, that you are aware that this isn't normal, but that is what you want, and that's fine. It's your body, your choice. You do whatever you want with it. So there is a bit of a balance of trying to work out whether that Pete Burns girl's actually was going through something, or actually she wanted to look like that.
Yeah.
I thought she was going through something, so I was like, no, go think about this, see if this is what you want.
I think sometimes with stuff like that, there needs to be, you need to have a 2-week think about this before you even.
You need more than 2 weeks. You need to speak to your therapist and then come back and see me once you've had a little session of therapy. Yeah. So that's probably one of the wildest things. I've had people call up. It's happened quite a few times. I don't understand how, because it's literally nothing with what I do, about having filler put in their vagina, and I'm
what
like,
does
that is a thing, but that is just not something I would offer. I just head and neck only, keep me away from something
above shoulders for me.
Not interested. Or you can have penis filler as well. Again, not doing that. Not for me.
What is that for?
So, penis filler is probably more popular.
I can kind of guess what that's for.
Well, it makes it girthier.
Okay.
But to me, it makes no sense, because filler is kind of like a softish kind of material. So it might be girthier, but it'll be soft, weird consistency. Like, I don't understand what we're doing. And the other thing I'd like to know is there's 1 or 2 people who do it in the UK, not many, not anyone I'd go to, is how are they doing it? At like what?
At what stage?
Yeah.
Yeah. I mean, you'll know more than me.
I don't. If you do some market research, let me know.
Chat GPT it later.
Chat GPT it. Or otherwise, some of the girls that I've called up that ask for filler is because they want to add hydration to it. So filler adds loads of hydration. So it helps to plump things up. So that is actually a thing. And medically, some of the gynecologists do actually provide that for women, where things have become a little bit drier. So you add a little bit of hydration and change the shape of things. But again, I would see, if you're going to have any treatments down there, please don't go to someone who's done a 1-day course. I wouldn't even come see me. Absolutely not.
Don't call again.
Don't call. Go see a gynecologist, because so much is happening down there. There's so much damage. You can cause like irreversible, life-changing damages if you do cause them with anything down there. So go see someone who's actually a specialist in that kind of area.
I think that's best.
Please. Yeah. I know my limits, and that's one of them.
So let's do a bit of quick fire myth busting.
Cool.
Lip filler stretches your lips permanently. True or not true?
True.
Okay.
If you overfill them. It's a bit like a balloon, right? If you blow up a balloon a little bit, take the air out, you don't get that sagginess, right? If you blow up a balloon a lot and you keep it blown up for a while, you take the air out, what happens to that balloon? It's saggy.
Yeah.
Exact same thing with the lip. So if the lip has been stretched for a long time, we put loads of filler over many years, even if it looks natural, and you take it all out, the skin has stretched. You will need a bit more filler back in there to hydrate it, to make it still look a little bit natural.
Less pruny.
So actually, a lot of other doctors will tell you no, but actually I think yes.
Okay.
There you go.
If you stop getting Botox, your wrinkles get worse.
No, absolutely not. You're never in a worse position with Botox in terms of wrinkles.
Really?
Ever. So if you have it once, never have it done again. In fact, you've had like a 3 or 4 month period, which is how long it lasts, of that skin not being creased. So you've had a 3 or 4 month time off aging and then you're back. So it's never worse. That myths comes from people have it and they don't have it for a long time and then they forget what they look like. And two, over time, every day you're aging. So you're naturally aging. So the results you're seeing is just your own body aging. It's nothing to do with the Botox.
You can dissolve any filler instantly.
Not instantly. It takes 2 weeks, but only hyaluronic acid based fillers you can dissolve.
And what's the other filler?
In the UK, generally we don't have them as much. People don't really use them.
Are they less safe?
They are less safe. They use them quite a lot in America, but they are classed as permanent fillers.
Okay.
Where you make permanent changes and it usually heals by
And
scar
that just
tissue.
doesn't go?
That does not go. That is
Really?
undissolvable, which is I just don't.
That sounds a bit iffy.
I don't play around with that. Absolutely not. I never have injected it. I actually had someone in 2 days ago who had gone and seen a friend of a friend when they were a lot younger, had some injections put in their lip, and they were like, it's just never went. What's going on? She did a lot of digging and found out actually she was injected with silicone rather than with a filler, which will never go.
So how do you actually get that out? Surgery?
Unless you have surgery. But even that, like her, sometimes with silicone, I can feel it and I can see exactly where it is. And
is it harder?
It's really, really thick, and you can have that removed. Her one wasn't, so I don't think you can ever get it removed. That's irreversible damage.
That's scary.
So fillers, yes, you can dissolve as long as they're hyaluronic acid based fillers.
Yeah.
So some of the brands, for example, like Revelax, Juvederm, Teoxane, all those kind of things, they're all completely dissolvable. Some of the other ones are not, but we don't really use them in the UK. They're not that popular at all.
Okay. Drinking water before and after filler makes it last longer.
Drinking water generally makes filler last longer, yes.
Does it?
Yes. So filler is made of hyaluronic acid. Hyaluronic acid absorbs 1,000 times its weight in water. First thing, when someone has filler in my chair, the first thing I tell them when they're in that chair, as soon as you get home, I want you to be drinking, flood yourself for the next 2 days, because that filler absorbs water. It looks more hydrated, it looks nicer, and it will last longer. Yeah, 100%.
I guess it kind of, it makes sense actually. It really does. All aesthetic treatments make you look fake.
No,
not
absolutely not in my hands. Good work, you will never ever notice. Bad work, you will notice. And that's the problem we have, is everyone only notices the bad work, right? No one ever notices good work, because you shouldn't. And that's what I try and explain.
What are we thinking about the at-home facials that you can do nowadays?
Right, so facial, I love facial.
Do you like clinic facials or at home?
At home, nothing beats an in-clinic facial. Nothing beats what your esthetician can do for you in terms of your skin, because they can actually assess your skin. They will change the plan depending on what your skin needs and give you what you want. But in between, there are definitely things that you can do to improve the quality of skin and to hydrate it. So as at-home facials, stunning if you're using the right devices in the right way, make sure they're safe and all that kind of stuff.
What are some good devices that we could use?
So my favorite one at the moment is Shark Beauty. Like, they do the LED masks, which we love, and they've got this like depuffy thing, which depuffers make things everything lifted. But they've
Are we pro LED masks?
Yes.
Okay, great. Because I've got one.
But it depends which one. I actually saw one today. I read it on the Daily Mail, I think it was, about Primark having their own LED mask, and I looked into it. And that Primark LED mask, it was, I don't know, it was like a couple of quid. It's basically fairy lights in a mask. So you're just literally holding fairy lights on your face. So don't do it. If you
Merry Christmas.
Merry Christmas, yeah. If you get that in your stocking, you're a fool. So LED mask, yes, if you're using the right one, they work beautifully. They're not a medical treatment, right? And there's a couple of articles going around at the moment how some of the companies are claiming they're like medical treatments and they're reducing acne and all this stuff. Absolutely not. They're not a medical treatment. The at-home ones are a cosmetic treatment. They will reduce blemishes. They will make you produce collagen. They might kill a little bit of bacteria on your skin, and they are stunning if you use it every single day. That's the key with at-home LED lights. You have to be very consistent to see results. And it works in conjunction with other treatments in skincare that you're using. So I love an LED mask. I tell all my clients to buy an LED mask, but it depends which one you get. Most of the ones on the market are honestly a load of rubbish, including the Primark one and some of the other big name ones as well. The Shark one in particular, stunning.
I got my mum that for last
Did you?
Christmas.
Oh, stunning. It's got that,
right
it's got this like, because I've got one, it's got this beautiful little icing thing, the cooling thing on your eyes, which really depuffs everything. So you can turn that on whilst you've got LED mask on. You can use it morning, night, in bed. It is stunning. It's really, really nice. But again, with those LED lights, for example, in my clinic, I've got an LED light. That Shark one is a cosmetic device. My one is a medical device. Mine does a lot more. So mine, at the end of every facial, we will use the LED mask on your face. It's super strong. You can have that once a month and it's fine. And that will kill bacteria. That will help acne, rosacea, all that kind of stuff. The at-home ones can't be as strong. I've literally got a specific plug for this because it's so strong. I've had to change like plugs and stuff because it's so powerful. So for you to see results from at-home ones, you have to use it every day. Shark one is really the only one I would endorse, and I'm not being paid, unfortunately, but I will take payment again. Always.
And this new device that they've got out.
So they've got a new it's like the first at-home facial machine that does hydration, it does extraction, and it's got like this dual heat which heats and reduces things.
Ooh, okay.
I think I've got it with me. Let's
have a look.
My lovely assistant could.
Okay,
so hopefully we've all had facials where like they extract, they do all that kind of thing. So what this does is it's got like this extraction tool, so it hoovers the skin up, so it takes your makeup, your debris, your clogged pores, it washes out blackheads, whiteheads, all that kind of thing. And then at the same time it comes with like different serums that you put in there, which is salicylic acid, which we discussed quite a lot, which is stunning for skin.
So you actually put that
in so it comes with little solutions that you put into this water bit, which is what I've got in there. And it washes out the pores. So it sends out a jet, washes out the pores, and then sucks it in. So it washes out through there, sucks it in through there, and then it takes it through. And then at the end, you get this horrible gunk that's all come off your face.
Will you see it?
Well, you will see it. Yeah, it's awful. It's either like brown. If it's like brown, it's usually makeup.
Yeah.
If it's like a clear or like got black little floating bits in it, it's usually like your black hairs and your dead skin cells.
Oh my god.
So this works beautifully. Yeah. It's like a 10-minute treatment. You just turn it on. And then it just like
spray at you then.
It will do a little bit of spraying in a second. And all it does, it just hydrates, sucks. See that? It just like sucks everything out.
Yeah.
While it infuses your hyaluronic acid and everything there. You can see the hyaluronic acid now coming out. So there you can have a little feel of that. It's like a 10-minute treatment at home. Lovely little facial device.
Oh,
You can see how it's like sucking and hydrating, and then can you see how that's filling up? Obviously it's just clear now because we haven't used it properly, but that will just fill up with a load of gunk. Really nice at home. If you're looking for a Christmas present for someone, this is probably quite nice to add into their routine.
So Shark are doing well on their
Shark are doing well with their devices. They just make really, really fantastic devices. They've got they've got something called the Depuffy, which is also quite nice, which is like lifts and sculpts. So yeah, facials I love. In clinic facials, nothing beats them. Nothing touches the sides of it. If you want like an in-between, a little quick, like before you're going out to an event, you want to cleanse everything, remove everything, make everything hydrated, you're going to need something
How
like
often
this.
do you recommend getting a facial and then using that in between?
A clinic facial, I'd say once every 4 to 6 weeks.
Yeah.
And then these ones in between, a couple of times.
Gorgeous.
Stunning.
And then the final question that we ask at the end of every episode, and then is basically your ride or die product of all time. Yeah. And it will get put in a giveaway basket for someone to win. So what is yours?
There'll only ever be one. And if anyone else is putting anything else in there, it's wrong.
Go on, what is it?
So I would say a retinol for sure.
Okay.
If you're not putting retinol on your face, you are doing something wrong. If you're not going to have any injectables, you're not going to do anything else, you're not going to use the devices, one thing I need you to do is to use some sort of retinol. A Medik8 Cristal retinol is going to be your chef's kiss. There is nothing better than that retinol. And normally you'll start very, very low. So in your giveaway, you're going to start with a really low one.
Yeah.
And then people will go up higher and higher and higher. It's the most anti-aging, anti-acne. Honestly, it does everything you want. It's the most tested skin product in the world. There's nothing more tested than vitamin A, which is retinol.
That's amazing. You've sold it to me.
Done. Get it on your skin ASAP.
I will. Dr Motox, thank you so much. It has been an absolute pleasure to have you
Thank you so much for having me.
Chair. Thank you.
Yeah.
Thank you so much for tuning into this episode of In the Makeup Chair. I actually cannot believe we have reached the end of the series. It's gone so quick. We have had so many incredible guests in the Makeup Chair. And whether you've been listening from the start or whether you've just joined us now, I hope you've enjoyed what you've heard. Let us know what your highlights have been in the comments. And don't forget to like, follow and subscribe. And we will see you soon in the Makeup Chair.